If you're retiring before 65, the month of the year that you pick isn't just a lifestyle decision. It's a decision that could cost you thousands in health insurance premiums, and most people realize it only after making it. In this video, I'm going to walk through 3 things that you need to know to manage your health insurance costs before you walk out of the office your last day. The first is your income for the year. You're going to need health insurance until Medicare eligibility, and for many, that's on the ACA exchange. Retire later in the year, you're going to have more earned income, which can put you over the ACA premium tax credit eligibility threshold. So let's see how timing affects a typical couple. So we're going to look here at Jeff and Joan. Jeff is 61, Joan is 60, and their combined earnings for the year is $250,000. Jeff has a chronic health issue, so they're going to meet their $5,500 deductible by June of the year. If they retire at the end of March, they'll have earnings of $62,500 in wages. And with things like dividends and interest, they're estimating their total modified adjusted gross income, or MAGI, for that year would be about $69,200. At that amount, that qualifies them for premium tax credits. And using the KFF calculator, the monthly health cost for a silver plan on that income is about $574. If they wait till the end of June, now they've earned $125,000. So they're already past the subsidy cliff, so 0 credits. And that monthly premium is going to be about $2,700. And their deductible resets. But they've already met their deductible by that time, so continuing with their existing plan with Cobra becomes the smarter move. And the monthly cost based upon Joan's cost for coverage in the prior year is about $2,200. If they retire at the end of October, now they've earned $187,500. And it's the same story, no subsidy, but only 3 months of coverage needed before the calendar resets. So likely, Cobra would be the better bet again. So here's the pattern. Retire earlier in the year, and you can still qualify for a subsidy. Retire later, and you can write out a shorter bridge before a clean slate on January 1st of the next year. Retire in the middle, and you're going to get the worst of both. No subsidies, and still months away from a clean slate, at least using the example here. So you have the same couple, same jobs. The only thing that changed is which month they walked out the door. Second is the Medicare trap. Here's something that surprises a lot of people, including some financial advisors. If your income drops low enough in retirement, you don't get a bigger subsidy, you become eligible for Medicaid instead. So if their income for the year falls under their state's Medicaid threshold, they're going to have to face a choice. Nobody forces you onto Medicaid. Applying is voluntary, but being eligible for it shuts off your premium tax credit. And that's whether you enroll or not. There's no version where you decline Medicaid and keep the subsidy. Once eligible, it's binary. You enroll in Medicaid or pay full price on the marketplace. But not every physician accepts Medicaid. So for a couple like this, which has resources and their specific care needs, that can matter more than any of the savings in the premium. So how do they actually hit that target? They're going to need to do some with advanced planning and planning done years in advance. For the years leading up to their planned retirement, Jeff and Joan have increased their cash in the bank to about $150,000 for living expenses. They own brokerage accounts worth about $200,000 and Roth IRAs worth about $120,000. The rest of their net worth is tied up in their retirement accounts. Now, they need to claim enough income to be ineligible for Medicaid and to maximize the premium tax credits. So let's see how they can do that. So they spend or anticipate spending $12,000 a month. So the savings, brokerage, and Roth balances won't be enough to cover everything over the 5 years. But they can spread that over the 5 years so they can reduce their total estimated premium costs. But word of caution here, they could keep their modified adjusted gross income near $30,000 by using their cash, brokerage, and Roth accounts to satisfy that $12,000 a month spending target. But in year 4, they'll spend those accounts to 0, and they'll need to take everything from their IRAs. And that would put them over the cliff, and they'll need to pay the full premium amount at that time. In this chart, I'm using an 8% annual premium inflation rate. So that would be about $3,400 a month, or about $41,000 in year 4. In year 5, Jeff is on Medicare, but Joan still has one more year, and her estimated costs will run about $2,200 a month, or about $76,000. So they'd be better off staying below the 400% poverty line and paying more on the onset, but saving more over that 5-year period of time. And then based on this example, it's just about $13,000 over that 5-year bridge. So this couple really has 3 decisions: when to retire, how to navigate the Medicaid line, and how to engineer the income once they know that target. They need to get all 3 right. And if they don't, the difference is thousands of dollars. Most people don't know this until after they've made the choice, and there's a nasty surprise waiting at the end. If this was helpful, hit the like button and consider subscribing for more.